Welcome back to another episode of This Month in Health. I'm Liz Ortiz. This month, January, is Cervical Cancer Awareness Month. It aims to raise awareness, educate women about prevention, and encourage regular screening. 2025 data from the North Carolina Department of Health and Human Services shows an estimated 428 women in North Carolina will be diagnosed with cervical cancer. Joining me now to talk more about cervical cancer awareness is Dr. Megan Huchko. She's an OBGYN at Duke Health. Dr. Huchko, thank you so much for your time today.
Hi, glad to be here.
Yeah, so let's start out with cervical cancer in general. Walk us through what that even is, what it means.
So cervical cancer is cancer that develops in the cervical part of the uterus, which is the bottom part which dilates when women are pregnant, and it occurs in about 13,000 women in the United States every year. When you go to your gynecologist and they screen you with a pap smear or an HPV test, they're screening you in order to prevent cervical cancer.
And walk me through the causes of cervical cancer. We hear a lot about HPV, which is human papillomavirus, how those two sort of work together and the causes.
Right, so HPV causes almost all of cervical cancers. We've learned a tremendous amount about the virus in the last 20 to 30 years. There are many different types. There are lower risk types, which can cause genital warts. There are different types which are considered higher risk. There are about 14 higher risk types that can cause cervical cancer. Most women and men at some point in their lifetime will be exposed to or infected with HPV. Most people will clear it pretty quickly. But in some people, when the HPV is not cleared quickly or develops into what we would call a persistent infection, it can integrate into the cells of the cervix and cause changes which lead to cervical precancer and cancer.
And you mentioned some people, or a majority of people, do clear it. If for a person it does clear, is that something they ever have to worry about in the future, or how does that work?
So if people get it on their own and clear it on their own, they can still get it again. They have some protection, but not as much protection as they would have if they were vaccinated. But yeah, people can have infections with different types. So having an infection with one type may not prevent infection with another type.
And when we hear about cervical cancer, I know it's often considered one of the most preventable cancers. Talk to me about why so. I know there's vaccine for HPV, so is that what we mean when we say this is one of the most preventable? So
we have two very powerful strategies to prevent cervical cancer. One is primary prevention with the HPV vaccine. There is a vaccine now which protects against 9 types of HPV. 2 of the types are the types that cause genital warts, and the other 7 are the most common causes of cervical cancer. So if people get vaccinated with HPV before they become sexually active, they have about 96 to 99% protection from the vaccine, from the HPV types that are found in the vaccine. Even after they've been exposed to or infected with HPV, vaccination can help prevent future infections or infections with other types. And there's some evidence that among women who have had cervical precancer, vaccine can help prevent recurrence of the abnormal cells. So that's primary prevention with the HPV vaccine, which ideally would be given to adolescent girls and boys, and maybe around the age 9 to 11, but really any time before sexual activity. And that's both because it's more effective if you haven't already been infected with HPV, but younger people tend to have a more robust immune response. So it works better in people with younger immune systems.
And go ahead,
for a long time had secondary prevention with screening. So I mentioned the progression between infection and development of abnormal cells. For about 60 or 70 years, we've had a pap smear or a cytological screening which can detect mild abnormalities in cells that will progress very slowly to develop into precancer. Now we couple cytology screening or pap smears with HPV testing because we know those cellular abnormalities that lead to precancer are the ones that are due to HPV infection. So with screening for that, women can get into surveillance where they are evaluated to see whether they're one of the people who have HPV infection that leads to precancerous cells that may benefit from a simple procedure to remove those cells. And that reduces their risk of developing cancer by over 90%.
Wow. And who is most at risk for cervical cancer? Are there any disparities in diagnosis or outcomes for those people?
So the main risk is that you have a uterus and cervix. So anyone with a uterus or cervix should undergo regular screening. The second biggest risk are people who don't get screened. And over half the cases of cervical cancer in the United States and more globally are attributable to people who haven't been able to access screening or didn't get the right follow-up from screening. And then there are some medical and biological risk factors, people who are taking any medications that would depress their immune system, people who are infected with HIV, people who have illnesses that suppress or impact their immune system like lupus, rheumatoid arthritis, people who've received stem cell transplants or treatments for cancer are at increased risk, and then people who smoke are at increased risk.
And let's talk about symptoms for cervical cancer. I believe I read that early on there may be little to no symptoms at all. But if there are any symptoms, what should women be looking out for, and at what point should they be seeing their provider? Of course, we want to have those regular screenings, but if there are any unusual symptoms, what would those be?
Yeah, so as you said, regular screenings are important without symptoms. Once people have symptoms of cancer, or once people have symptoms, it's more likely to be an invasive cancer rather than a precancer. But concerning symptoms you would want to see your gynecologist for include abnormal bleeding, so bleeding after intercourse or bleeding between periods, any abnormal discharge, or pain in that area, bleeding with urination, or unexplained weight loss.
And when it comes to cervical cancer in your practice, are there any common myths or misconceptions that you hear, even just about the pap smear or about cervical cancer in general, that you would want to clarify?
Well, I think one thing we do know is cervical cancer is not genetic. We don't think there's an inheritable gene. It's really due to HPV infection. It is treatable. So once a woman is diagnosed with HPV, there's no treatment for the HPV infection itself, but there would be treatment for the precancerous cells if she was diagnosed with that. Cervical cancer or HPV infection are not related to fertility, so getting the vaccine doesn't impact fertility. Getting diagnosed with HPV doesn't impact fertility. And in fact, screening is important for people who want to have children in the future so that they can preserve the uterus and cervix, and things that can get treatment for precancer and have more options than they would have if they developed invasive cancer.
And speaking of screening in particular, what are the current screening recommendations for cancer, pap test versus the HPV test? What are those recommendations exactly?
So there are several different strategies of combining the pap smear with HPV or testing for HPV alone. So for younger women, there is a greater risk of having HPV, but they also clear that infection and are less likely to get precancer or persistent infection with HPV. So we don't really start HPV testing until 25, and that's if it's done with pap smear. HPV testing alone should start at 30. So for what we would call primary HPV screening, or with HPV screening, is the first test. women should start that at age 30 and continue every 5 years until they are 65. Those are general recommendations. There can be more individualized recommendations if people have different risk factors or they've ever had an abnormal screening test in the past.
And I was reading, and I'm sure this is a case-by-case basis, but for those who do have HPV, possibly coming annually for that screening.
So so once someone has an abnormal screening test, there are guidelines for their follow-up. So if someone has just an HPV positive result, depending on whether they also had a pap smear at the time and whether that pap smear was normal, they can just get a follow-up in a year to see whether that HPV has cleared. For certain higher risk types of HPV, we might recommend a second test called a colposcopy for that.
And walk me through what that means, what that is exactly.
So for women who have an abnormal pap smear or HPV test that puts their risk of precancer at higher than about 4 or 5%, we would recommend they get a colposcopy, which is, the colposcope is a microscope for the cervix, and it's done by a gynecologist through a pelvic exam in which the cervix is examined with a bright light and magnification. We add a couple different solutions to the cervix to see if any areas turn different colors, and if there's anything suspicious for precancer, we would take a small sample at that point. And the results of that biopsy would help inform whether someone would need additional treatment for cervical precancer.
Got it. Good to know. And I'm sure you heard about the new federal guidelines that allow for the self-swab test, so sort of like an at-home pap smear, if you will. What do you know about it? What are your thoughts on it? And could this really help with catching more potential cancers early on?
Yeah, so I think it's great, and I think it could provide an avenue for really patient-centered screening for people who don't tolerate pelvic exams very well or have challenges getting into the clinic. There is a commercially available swab that can be mailed to someone's home, and they can mail it back into the company and get their results and get referred for the appropriate follow-up. And there's now, for women who come into the clinician's office, instead of having a test done with a pelvic exam, which would include a speculum, which some women might find uncomfortable, or might have biologic or different types of anatomy, which might make it really difficult for her. They can collect that specimen on their own, and we've offered self-collection for different sexually transmitted infections for many years now, and we found that many people really prefer to collect on their own. And so hopefully, if undergoing a pelvic exam with a speculum is a barrier to screening, being able to self-collect will encourage more women to get screened.
And I'm sure there are detailed instructions with it. Are there any concerns, though, from a provider perspective that maybe the specimen isn't collected properly, or maybe have you heard from women that they're not sure if they did it right? It hasn't been quite widely enough spread in the United States yet to have that kind of feedback from women. I do a lot of work in lower resource settings in Africa, and there are some concerns, but once women do the test and they see how easy it is, that develops their confidence in it. So the tests are run so that if they aren't collected appropriately, they won't get a false negative. They'll be told they need to retake the test. And usually at that point, we would recommend that a clinician collect it. There is a small decrease in the sensitivity of the test, which means it's a small decrease in its ability to detect HPV. So instead of getting screened every 5 years with self-testing, the recommendations would be to get screened every 3 years to make sure that nothing's being missed. Gotcha. And with the HPV vaccine, I know you touched on this a bit already, but I know children the age range is about 11 or 12, correct me if I'm wrong, when you start that vaccine. But into adulthood, let's say you've already been exposed to HPV, can you still get that vaccine? Do you still recommend it? And if so, up until what age?
So we recommend it until the age of 26. We think that there is really a robust immune response at that age, and the exposure to HPV or the development of precancer are much lower at that age. But women can get it up to the age of 44, and between 26 and 44, for both men and women, we recommend shared decision making with the clinician about their risks, sexual partners, and whether they think they would benefit from getting the vaccine series.
And for parents who, maybe listening, they have a preteen, they're sort of getting to that age range of when the HPV vaccine will be presented to them rather. What would you want them to know about that vaccine in particular, or the importance of getting it and that sort of thing?
So, biomedically, I would say it's one of the safest vaccines. It's a really novel structure that it targets the proteins in the vaccine. It's very safe. It's very extensively studied. There have been really no serious adverse effects associated with it. I think on a significance level, though, I will share that about a year ago I went to a meeting in which a cervical cancer survivor spoke about her experience getting diagnosed with cervical cancer in her late 20s and how it impacted her life, it impacted her fertility. And she said, people pray or really, want a cure for cancer. And here we have this very powerful tool in our hands. If she could go back in time and take that vaccine, which is so effective at preventing HPV and preventing cancer, she would encourage everyone to think about that as the answer to the prayer for the cure for cancer.
Yeah, that makes a lot of sense. And when it comes to reducing barriers to care, do you see any other avenues or ways in which healthcare as a whole can sort of improve to even expand just the access to the screening and the access to care? I know you mentioned rural communities, even the uninsured. Anything that could be done better in the future?
So I always think integrating vaccine or screening into visits that people are already attending is really helpful, and maybe people would be more comfortable getting screened through a primary care provider if they can self-collect. Primary care providers who might not have the staff, and the supplies to do a pelvic exam or feel as comfortable doing a pelvic exam might feel more comfortable offering women screening with self-collected HPV. I think the key component that we have to include is making sure women get the right follow-up and understand the difference that they would need if they screen with a clinician-collected exam versus a self-collected exam. And remember that the screening test doesn't have any value if women don't get the results, understand the results, and understand the next steps in their care.
Absolutely. All important information, Dr. Huchko. We're going to pause right there. When we come back, we'll talk more about how we can empower women to get those screenings and just share more advice about Cervical Cancer Awareness Month. So we'll be right back. Stay with us. Well, welcome back. We continue the conversation with Dr. Huchko about Cervical Cancer Awareness Month. Dr. Huchko, we were just talking about the guidelines for when children get the vaccine, why it's important to get the HPV vaccine. You mentioned some new guidelines that came out yesterday. Walk us through what those are.
Yeah, the HPV vaccine had initially been given in a series of 3, and then with new evidence for kids younger than 15, we were giving it in 2 doses, but yesterday the guidelines were updated to recommend just a single dose. And so something important to remember is that because the younger immune systems are a little bit more robust and children, are able to respond more effectively to vaccines, getting the vaccine when kids are younger at the recommended age rather than what we would call the catch-up age up to 26 or between 26 and 44. It's simpler. It just requires one shot and can save them trips to the doctor and save them additional shots in their arm.
Good to know. And I'm curious too, have you heard of any sort of fears or emotional barriers from patients that maybe keeps them from getting screened? And what would you say to them to help overcome those fears or those barriers?
Yeah, I think it can be scary to get screened for cancer. And I think people want to, some people react really emotionally to having a positive HPV test or an abnormal pap smear because they are afraid it means they have cancer. And I like to encourage people to think of it as now having this powerful knowledge that they can do something about, and the actions that we can take with a positive or an abnormal screening test are so effective at preventing the cancer that really getting the screening is knowledge, and then going through the next steps will help ensure that they do not develop this preventable cancer. So sometimes I think really focusing on what the positive actions can be rather than what are the possible outcomes that we're trying to avoid can help women think through it.
Right, and even with pelvic exams just alone, I know there could be some fear or anxiety about that. Even some people may feel embarrassed about it. How do you sort of navigate that as well?
Yeah, I think, having a provider that will talk you through what they're doing and explaining your concerns or fears about having a pelvic exam can really help this be something that's done together with the provider instead of something a provider does to a woman. And as a gynecologist, I want to know if women have hesitation or concern or have had prior experiences that might make pelvic exams harder for them, so that we can work together to figure out what's the best way to do this. Do we need to come back on a different time? Some women need to have a little bit of medication before they do a pelvic exam. Some
Right.
people like to have a partner or a hand holder in the room with them. So I would encourage women not to be afraid to talk to their provider or ashamed of bringing up hesitations around pelvic exams, because we want to make this the most comfortable thing for you. We don't want this to be something people are afraid of when they come to see their doctor.
And for some, insurance or no insurance could be preventing them from going to a doctor, maybe no regular OBGYN. Are any advice or any resources in the community that you would point them to so that women can get those screenings and stay regular with that?
So there are programs which cover cervical cancer and breast cancer prevention in North Carolina, and so the best place to access those programs is through the health department. And so in Durham or in any county health department would have resources for women to get cervical cancer screening.
And curious if family members, partners, loved ones can do anything to support women when it comes to cervical cancer prevention.
Yeah, I think that getting encouragement from friends who have done it, from loved ones, from parents, or even from children is really helpful. Helping take their spouse, their girlfriend, their mom to the doctor's office, or talking to people about their own experience and how it felt empowering to them to get this test done, understand the results, and then go through the next steps. All those are really helpful things. The more we talk about this and normalize this as just a part of healthcare prevention that people do, and the more acceptable it's going to be.
Yeah, absolutely. That's why we want to have this conversation, raise awareness in January and really year round. And also, I know there's always ongoing research when it comes to just cancer in general, but with cervical cancer in particular, is there any research going on that you know of or that gives you any hope for the future when it comes to hopefully one day eliminating it altogether?
Well, I think we're seeing, we have more, we have incredibly effective tools right now, and having these guidelines for self-screening come out and having the different strategies for follow-up based on different test results is a result of years of really innovative screening, so innovative research. So I think, there's always research looking for the most specific screening tests so that we can eliminate the number of visits women have to go through to if they have an abnormal test, and then get a biopsy and then treatment. So I think getting access to self-tests in the home and getting approval for the self-tests in the clinic and coming up with evidence-based strategies for the frequency and the follow-up of self-tests is really reflective of a lot of important research. And I think the next steps are continuing to look for the most effective, lowest cost biomarker that could even improve on the HPV test. I think there's still research into, how many different types of vaccine of HPV can go into the vaccine. Right now there are 7 of the high-risk types that go in. So what would a vaccine look like if we had 10 types or all of the high-risk types? And so there's some studies going on right now to look at that.
This all sounds very, very promising for the future. Yeah. Well, Dr. Huchko, if there's any one message, any one actionable thing a person could take away from this, what would that be from our conversation today?
So in 2018, the WHO made a call for elimination of cervical cancer, which is the first time that they've called for the elimination of cancer, which is not an infectious disease. And it is because it is a unique cancer that we have the ability to prevent. Some countries are almost there. So Australia is almost there with a combination of screening and vaccination. And so we have these powerful tools to prevent someone's risk of developing a cancer, which can be very painful, very difficult to treat. But the prevention through vaccine and screening are simple and straightforward and not painful. And so I would encourage everyone to really take advantage of these prevention tools and encourage their partners, their daughters, their mothers, their sisters to get screened and keep up with screening so they don't have to develop cervical cancer in the future.
All important and great information, Dr. Huchko. I appreciate your time talking about this topic. Anything else you want to say or add before I let you go?
No, thanks for giving us the platform, and I'm glad that we're getting more information out this month during Cervical Cancer Awareness Month.
Absolutely. Well, thank you so much. And that'll do it for this episode of This Month in Health. I'm Liz Ortiz.